Hello, guys. I'm back, and thank you all for coming back and tuning back in for the next part of the NHA phlebotomy study questions. Okay, so let's jump right in. Make sure you like and subscribe to the channel. I will be coming on for more day in the life of a phlebotomist. You know, I can take you with me to work sometimes, so um, different things that I've learned or that I'll be learning throughout the whole process. So tune in and subscribe, and let's get right into it. Question number one. A phlebotomy technician is working with a patient who has Mycobacterium tuberculosis infection. Which of the following transmission precautions should the technician use for this patient? And the correct answer is airborne precautions. Airborne precautions. Okay, number two, a phlebotomy technician is processing a semen specimen. Which of the following actions should the technician take? So for semen specimens, you deliver the specimen to the laboratory within 2 hours. 2 hours of taking a semen specimen, you deliver it for optimal results. Number three, a phlebotomy technician is an outpatient facility finds a patient who is in shock and bleeding profusely from his leg. Which of the following actions should the technician take first? And when you're bleeding profusely, you need to immediately apply direct pressure to the wound. Apply direct pressure to the wound. Okay, excuse me. Number four, a phlebotomy technician is selecting a site for a blood draw from a patient. From which of the following veins should the technician attempt to draw first? And the first choice should always be the median cubital. That should always be the first attempt to draw there. And then, if you can't draw there, the other choices should be the cephalic and then the basilic. Okay. Number five, a phlebotomy technician obtains two readings of 17 milligrams or deciliters when performing a glucometer test for a patient. Which of the following actions should the technician take? So 17 is too low. So my first thing would be, okay, does this thing work? And that is the correct answer. You would perform a set of liquid controls. The technician should perform quality control testing, to verify that the glucometer is working correctly. Okay, number six. Before collecting blood from a patient in an inpatient setting, a phlebotomy technician notices that the patient does not have a wristband on his or her arm, but there is one attached to the patient's IV stand. So, which of the following actions should the technician take? And if the patient does not have a wristband on, you need to hold the draw until the nurse has come in and actually attached that wristband to the patient. Okay, number seven, a phlebotomy technician is preparing to perform a blood draw on a patient who had a left-sided vasectomy and has an IV on her right side. In which of the following locations should the technician perform the draw? And so we know that you cannot perform a blood draw on the side that you had your mastectomy. So that's the left side. So that's off limits. So the right side, you have to always get the nurse to shut off the IV machine and draw below the IV site. Below the IV site. A phlebotomy technician is preparing to obtain a blood specimen from a patient Um, One moment. My computer. Just one moment. Okay. Okay. So, a phlebotomy technician is preparing to obtain a blood specimen from a patient for a erythrocyte sedimentation rate test. The technician should select a collection tube that has a top with which of the following colors, and that would be lavender. The technician should select a collection tube that has a lavender color top when collecting for a erythrocyte sedimentation rate test. Okay, which of the following tests is the most common point of care test performed at home and in medical facilities? And that is the glucose test. Most people have a meter in their home, and that's the most popular or test or most performed test is the glucose testing. Okay. A phlebotomy technician is instructing a patient about how to collect a fecal occult specimen. Which of the following instructions should the technician include? So the correct answer for this, well, I will give all selections. So A is avoid taking ibuprofen. B, collect fecal specimen for 2 days. C, decrease fiber intake. D, refrigerate each card until transporting them to the laboratory. So the correct answer is A, avoid taking ibuprofen. The technician should instruct the patient to avoid taking ibuprofen, which can cause false positive test results. Okay. Which of the following actions should a phlebotomy technician take to verify the quality of venipuncture supplies before beginning a blood draw on an adult patient? And the correct answer is inspect the integrity of the needle's seal. The technician should inspect the integrity of the needle's seal to ensure it's sterilized, sturdy, no damage to it. Okay, a phlebotomy technician is verifying a patient's identity before performing a venipuncture procedure. Which of the following information should the technician request from the patient? So to verify, remember to verify the patient's, you have to have the patient's full name and date of birth. Okay, number 13, how frequently should a phlebotomy technician perform a quality control test on a glucometer in the laboratory? And I went over this, I think, the same question yesterday. I guess they just asked them in different ways, but it's still not going to change. It needs to be every day. Every day the meter's used. Okay. A phlebotomy technician is preparing to collect a patient's troponin T levels. Which of the following troponin T levels should the technician immediately report to the provider? For troponin, it's zero point 0.3 milliliters, 0.3, 0.3. The technician should identify that a troponin T level of 0.3 is above the expected reference range of 0 to 0.2 milliliters, 0.2, and is therefore a critical value. The technician should immediately report these findings to the provider. Okay, number 15, for which of the following conditions does emergency first aid treatment include maintaining an open airway, controlling bleeding, and keeping the patient warm until help arrives. So that's when the patient has gone into shock. So the correct answer is shock. The technician should identify the first aid treatment for shock includes calling for help, maintaining an open airway, controlling bleeding, and keeping the patient warm until help arrives. Okay. A phlebotomy technician is preparing to obtain a blood specimen from a patient for thyroid studies. Remember this, thyroid studies. The technician should select a collection tube that has a top with which of the following colors. So for thyroid testing, you do the speckled top. The technician should select a collection tube that has a speckled top when collecting a specimen for thyroid studies, T3, T4, and thyroid stimulating hormones. So remember that thyroid, the speckled top. Okay, number 17, which of the following information should a phlebotomy technician document when adhering to the chain of custody guidelines? So when you're doing a chain of custody, you need to you need the identity of everyone who has possession of the specimen. You have to initial each time it's passed off to somebody. So remember that. You have to have initials. Okay, 18. A phlebotomy technician should select a tube that has which of the following anticoagulants to collect a sample for a PT and PTT test. So the PT or the PTT, that test is it's going to be that light blue tube, which is going to contain sodium citrate. So, or you can just know that it has to be the tube with sodium citrate. Okay. Number 19, a phlebotomy technician is preparing to perform a venipuncture on a patient. Which of the following types of consent? I'm sorry. One moment. I just got a message on my phone which distracted me. Okay, a phlebotomy technician, this is number 19. A phlebotomy technician is preparing to perform a venipuncture on a patient. Which of the following types of consent is the patient providing when she or he extends their arm to begin the procedure? So that's just when you extend your arm, roll up your sleeve. That's considered implied consent. Implied consent. Number 20, a phlebotomy technician has a requisition form for a series of tests on a patient's serum. The technician should select a collection tube that contains which of the following additives? And the correct answer for a serum would be it needs to contain thrombin. The technician should use a collection tube that has the additive thrombin, which helps accelerate clotting for the serum specimens. Thrombin. Okay, I'll do a couple more. So 21, a phlebotomy technician is preparing to draw a blood sample from a patient for a glucose tolerance test, GTT. And notice there's an empty breakfast plate on a bedside table. Which of the following actions should the technician take? And they have a lot of these questions that try to trip you up. So I'll give all of the examples. So A, ask the patient when he has ate or drink. B, call the dietary department to see if the patient ate his breakfast. C, delay performing the draw for 4 hours. And D, refuse to collect the specimen. So you just use process of elimination. You can't refuse that. They have to refuse. And let's see here. So delaying the draw, no, you don't delay the draw. Call the dietary department to see if the patient ate the breakfast. Um, no, you just simply ask the patient when he ate last. So that would be the correct answer. Ask the patient when he ate or drink last. The technician should ask the patient to verify when they eat or drink and not assume the breakfast plate belongs to the patient. Okay. 22. A phlebotomy technician is preparing to collect a timed medication draw ordered for 1400. The technician should verify when the patient received his previous dose of medication with which of the following members of the interprofessional team. So the only person that you need to be asking anything to when dealing with the patients is the nurse. So the technician should verify the time of the patient's previous dose of medication with the nurse when collecting a blood specimen for a timed medication draw. The nurse. Okay. And number 23, which of the following actions should a phlebotomy technician take to maintain compliance with HIPAA? And this question was on the test too. A lot of these were, but I remember this. Um, so I'll read the question. Which of the following actions should a phlebotomy technician take to maintain compliance with HIPAA? A. Discard test results into the office trash can. B. Leave patient information next to the printer. C. Clear phone numbers from the fax machine. D. Share passwords with other facility staff. So the correct answer is clear phone numbers from the fax machine. Um, you don't ever throw test results in the trash can. They're supposed to be shredded. Um, you leave the patient information next to the printer. No, you never do that. And you're never supposed to share passwords. Okay. 24. A phlebotomy technician is preparing to draw a peak level for a medication that was administered orally to a patient. After verifying when the patient received the medication, how long should the technician wait prior to attempting the draw? This is for peak. So the peak is 2 hours after administration. The technician should collect a peak level 1 to 2 hours following an oral administration to ensure that the medication is not at a toxic level. So that would be 2 hours after administration. And for our last question of the night, which of the following test results are affected when a phlebotomy technician uses providone iodine to cleanse a site for a dermal puncture? And the correct answer, I'll give you all of the choices. So A, glucose is not, I'm sorry, glucose. B is blood, the blood nitrogen levels. C, potassium, and D, coagulation studies. And it's the potassium is the correct answer. Iodine is iodine affects potassium test because it can cause a false elevation of potassium in a specimen. So it causes an elevation in potassium when you use iodine. Okay, so that was 25 questions for tonight. So I did more than I did yesterday, and I will return tomorrow with another video, 20 more or 25 more. So thank you guys for tuning in, and I hope these videos are helping you. Just remember to like my videos and subscribe, and thank you all so much, and have a great day.